So today we're going to talk about acute pain. So I often see comments on Facebook that somebody had an injury, and I hear from friends about injuries, and I thought I would just put some information out there about acute pain, acute musculoskeletal pain, and also acute pain when you don't have an injury. Some people have a flare up of a past pain, but they can't associate it with any specific injury. And kind of wondering what that's all about and how might you manage that differently from acute pain when you know you have an injury. So the first thing that you want to think about when you have acute pain or an acute flare-up is don't panic. You want to keep your nervous system calm and let the body do what it's supposed to do. Don't panic because your body was set up, it has developed, it knows how to handle acute injury and acute pain. So don't panic, because the nervous system can tell the brain stories about how this is going to last forever and maybe I'm never going to get out of pain. So just considering that you don't want to panic, that's the first thing. So here are some of the reasons why you have acute pain. You have an injury and you know what that injury was, and then you really want to pay attention to healing times and what to expect over the time frame of healing. So I'm going to give you some information about healing times. If you did not have an injury, but you're having an acute flare-up, or maybe you have a new pain for the first time that you've never had, but you did not have an injury that you can remember, you want to ask yourself what else is going on. Could this possibly be related to some stress in my life? And sometimes even if you have an injury, but it wasn't that big, you think it's a mild injury, but your pain is extreme, that again might be that stress overlying on that injury and amplifying how much pain that you have associated with that injury. So let's talk now about injury healing time. So if you know you had an injury, what do you expect over that next week, over that next month? So you know when you had your injury, and so for 7 to 10 days, that is what we call the acute inflammatory reaction. You're going to have your traditional signs of inflammation and injury: redness, swelling, pain with movement. The area might be warm. This could be of the joint, the ligament, or the muscle. And so what do? In the first 7 to 10 days, you really want to protect that area. That doesn't mean you brace it up rigidly. You kind of let pain be the guide. How much can you move? Say it's your neck or your shoulder or your back. How much can you move before you really move into pain? You want to do as much movement as you can, but you don't want to stretch at this point. So if you have an acute injury, lay off of stretching, because what's happening during that acute phase is it's bringing a whole bunch of chemicals to the area in order to try to heal that part. And then it's trying to lay down some tissue to create a scar. So if you stretch that area, you're going to break that scar. So if you do something within that first 7 to 10 days that you feel like it's a re-injury, you are starting the inflammatory process all over again. After 7 to 10 days, you should start to feel better, but you're going to still notice pain into 21 days. So from 7 to 21 days, so for the next 2 weeks, you have what we call subacute inflammation. And all of that scar tissue is trying to be laid down. So you still want to only have very controlled movement during that time frame also. You still don't want to stretch during that time frame. You want this like nice patch. You think about, if you've ever watched an injury or a scab or a wound heal, you know that that area is trying to patch itself. The same thing is going on in your muscles and your joints and your connective tissue. So that scar that is laying down is vulnerable, and you want to kind of leave it alone, though you should be able to return to regular activities. You should be able to do some gentle muscle contraction and some range of motion around that area, still trying to stay within a pain-free range. You might want to go a little bit into or notice where the pain is and then back off and see if every day from that 7 to 10 days to the 21 days, see if you can keep improving your range of motion through that time frame. You might still notice a little bit of swelling during that time, but it shouldn't be that big swelling, like if you think of a swollen ankle, it shouldn't be that big swelling that you notice in the very beginning. After 21 days, you're really ready to rehab. You're ready to start strengthening. You're ready to start lengthening that area. So you can go back to stretching. You can go back to almost normal activities after, because during that first 21 days, you haven't done that much. So you can expect that muscles around the area have atrophied. So give yourself a chance to come back from that injury with better strength before you go about doing your normal, exercise activities. Say you could get back to regular routine daily activities, maybe just not exercise quite yet. The other thing we want to talk about is managing stress to prevent chronic pain. So we just talked about the normal tissue healing process is 21 days. However, if during that time frame you are in that panic mode and you're not recognizing that this is a normal healing process and that the pain, the loss of motion is to be expected, and you panic, you can really set yourself up for some more chronic pain related to this area. The stress, and many of us have just routine chronic stress, so we don't really notice it, but you may have some heightened symptoms because of that chronic stress, and then you begin worrying. You have negative thoughts about what's happening in your body. Healing process, what we think in our mind can actually affect our body. And so if those pain and other symptoms are lingering beyond that normal healing process, you need to look at how you're reacting to it and maybe go get some help. And the help, maybe physical therapy, can sort of downplay some of those negative reactions and that worry to what's going on and help you understand that this is normal. And maybe you just feel like you need guidance through the process of this injury. And that's fine too. That's to be expected. If you did not have an injury and this flare-up is lasting, it may be a sign. Your body's going to tell you things. A sign that you need to pause and really take care of you. And I know that might be difficult for some people because we're doing so many other things. As a mom, I'm taking care of the family, and you don't feel like you have a chance to really take pause and take care of you. But if your body's getting run down, it's going to speak to you and tell you that you need to stop and take care of yourself. And so you need to maybe look across your day, your week, your month, and say, what can I get rid of right now? How can I just say no to a few things and take better care of myself? Don't take on another task. Maybe your body is saying it's time to take a vacation, if you haven't had one for a while. What can you do right now? So how can you take care of some of these symptoms? If you are having an acute injury, you want to use the mnemonic of PRICE. And each letter stands for something. P stands for protection. So there's a lot of protection in that first 7 to 10 days. You want to protect the area. After that 10 days, you want to start more controlled movement. The R stands for rest. And I like to talk about relative rest. You're not wrapping it up as tight as you can and not doing anything with that area. If you feel like, if it's like your ankle or your knee and you feel like you can start to begin putting weight on that foot or leg, you need to start doing that as soon as possible. But if using a crutch normalizes how you can walk, then it's okay to use that. But again, you want to look at 7 to 10 days. Boots right now are really popular for ankles and feet. That's okay, but again, you want to get out of that boot, make sure you're doing some range of motion with the foot and the ankle, and progress out of that boot as quickly as you can. Should you use ice or heat? If you had if you know when that injury is, you should use ice for the first 48 hours. If you've had a flare-up and you did not have an injury, you can use heat. If you don't suspect that there's any tissue damage, specifically from an injury, then you can use heat. If you like ice and you want to use that for pain control, you can use ice. But when you have a specific injury, you want to use the ice to prevent, a lot of swelling in the area. I wouldn't overuse ice because you need some of that, the fluid into that area to help heal that area. PRIC, C is compression. So if it's an area where you feel like you can wrap it and get some compression, then that can help also. E is elevate. So again, if it's an area where you feel like you can elevate, ankle, knee, elbow, hand, wrist, something like that, it's easy to get those areas elevated. Not so easy in the spine to follow those guidelines of Price. I do want to mention some red flag signs. If you have an injury and you're not sure whether or not you need to go see someone for this injury, there's some guidelines. So if it is an extremity, if it is your lower extremity, your foot, ankle, or knee, some of the guidelines are if you cannot put any weight on that injury immediately after the injury, so immediately, and that is before the swelling can occur, then you probably want to go see somebody. A few years ago, I missed the last step in my house going down into the basement and fell and sprained my ankle pretty significantly, and it hurt, but I could put weight on it immediately after. The next morning when I woke up, even though I had done the icing and the compression, it still was swollen. And when I went to get out of bed and put weight on that ankle, it was so much pain with that weight bearing, I literally hit the floor. And I thought that I had broken something. But, I tried to remember some of the rules of injury and knew that because I could put weight on it the night before the swelling started, then I knew that I probably hadn't broken something. With the spine, if you have, after an injury, progressive numbness or loss of sensation in either your arm or in your leg, your foot, and also if you have progressive weakness after the injury of a neck injury and you have some weakness in your hand, or you begin to have some weakness in your foot that you can notice, that is a time when you want to go to the urgent care, to the emergency room. You want to have that checked out. Now, if it's a usual sensation that you're used to and it's nothing new, then it might not be what we call that red flag sign, that red flag that gives you that warning that you need to see somebody. What can you do immediately when you notice this new pain, this acute pain, whether it's from injury or if it's just a flare-up of a previous injury? Again, the first thing is to pause, take a breath, and don't panic. Gentle movement is fine. So wherever the body part, if it's the knee, you're doing some bending and some straightening of the knee. With the ankle, moving it back and forth. The low back, you're doing some pelvic tilts. I talk about just gentle cat-cows in a lot of different positions. You want relative rest. You do not want bed rest for any period of time. So backing off of usual activity is okay, but you don't want to stop activity altogether. You want to keep moving as much as possible. Find ways to relax. So, and making sure that you're getting adequate sleep so that that body can heal itself and do the repair that it needs during sleep. Every day after the injury or after that flare up, try to do a little bit more every day. Move a little more. Do one more activity. Don't baby yourself through this. Again, unless you notice some of those warning or red flag signs. I have on my YouTube channel some gentle movement for the knee and for the spine. You can always get guidance through this. In many states, you have the ability to see a physical therapist without a referral from a physician. Yes, insurance most of the times will cover that. So there may be limitations, so you need to know what your insurance, but sometimes it's worth it just to, pay an upfront fee to have a lot of guidance with an initial injury or a flare-up. And make sure that therapist is educating you on what you should be doing at home. They're only going to see you for, 30 to 60 minutes. So they need to be educating you the whole time about what it is that you can be doing at home specifically for your injury. The American Physical Therapy Association has created a new website, choosept.com. I will put that information in the post associated with this Facebook Live so that you can get to those links. And Choose PT is a way for you to find a physical therapist in your region, and I highly recommend that you do that. Don't panic. Manage acute pain. Don't baby yourself. You can work through it. Be very confident that the body can heal itself. I'm Stephanie Carter-Kelly, bringing you information as I see that you need it through these Facebook Lives. Have a great day.